What are some actionable steps that you can take to transform our health system? This is one question that you've sent me and that I'm going to answer today. I'm Dr. Chad Swanson. I'm committed to historical, paradigm shifting, transformational change in our health system. It is gravely needed. One question that was asked and that I started to answer on a previous video is, what are some actionable steps an average person can do something today to transform the health system? So I started talking about how in the previous video, I discussed how a recipe or a blueprint isn't likely going to be effective because our health system is so complex and there are so many different people and organizations with diverse backgrounds that have strong opinions and invested interests, that one specific plan isn't likely going to be effective. So I think the most important thing is to have a shared vision, a powerful shared vision of health for all at the lowest possible cost to the system. And number two, as many incentives, financial and non-financial incentives, aligned with that vision. So I think we need 10 times more people than we currently have that vision, and 10 times that many people that are united with that vision. So I recommend starting where you are. So you may be a healthcare worker, you just may be a concerned citizen, you may be a politician, you may be a CEO. Start where you are and what interests you or what drives you the most. You may be interested in advancing mental health for all because of the challenges that a family member has had. You might feel strongly that a certain policy or a policy approach is best for healthcare. You might view the health of homeless people as, you might feel a moral responsibility toward helping them. So start with where you are and what you're passionate about. And then learn about health. So not just your specific issue, but learn about the key drivers of health. Learn about how health can be improved within communities. For example, I was very surprised to learn that only about 5 to 20% of our health status that we can change is due to the efforts of doctors like myself and nurses in hospitals, so healthcare. The other 80 to 95% is due to our relationships, our diet, exercise, and social connections. And so if we think of the health system as a system to improve health and maintain health, then we need to look beyond simple health care. So the second, again, is learning about health, its drivers, and complexity. So there's a paradigm that I learned about that's really changed my view of how to think about social change and our health system. It's called complex adaptive systems or systems thinking. It's really considering the health system as a dynamic, ever-changing group of organizations and people and the relationships between them, as opposed to just considering the specific parts individually. So we inherited this paradigm, this theory, this way of viewing the world, where we take the body apart into different systems, the circulatory system, the nervous system, etc. Or we take the health system itself apart. We've got emergency physicians and respiratory therapists and health university health professors and public health project managers. And we don't adequately consider how those various parts interact over time to impact our health. So that's number two of my recommendations: learn about health, the drivers, and complex systems. And then three is connect. So you'll have a topic that interests you. You'll have this broad understanding, maybe just a superficial understanding, but an understanding of how your specific interest fits into the larger system, the larger drivers of health, and the complexity of the system. And then connect with others in your community, online, so that you can learn and together rally around specific leverage points. So that's number three. Number four is really quite crucial and doesn't get enough attention, I don't think, and that's the importance of setting aside political biases, preconceived notions, etc. So we're all imperfect human beings. We have biases because of our background, because of our specific political persuasion, whatever the case may be. And I certainly I'm not suggesting that we should leave those behind, but I do think we all need to recognize that we are influenced by others, even at the expense of facts or humanity. So there's groupthink and there's the cognitive dissonance that comes with changing our views. But we really, I think that's my fourth step, is to set aside political biases, preconceived notions, etc., and make decisions as much as possible on facts and knowledge and humanity. So number 5 is act where you think will be the highest leverage after we've connected with others. So that might be a specific policy. It might be changing a curriculum. It might be forming an organization. So leverage points are where at a specific given point in time, there seems to be enough momentum, enough need, and the opportunity for a significant change to happen. And then number 6 is be relentless. So it's impossible to know with certainty when a complex system like health is going to change into a new paradigm or a new phase shift. But by being relentless, we can increase the chance that will happen. So this is, just as a reminder, this is my informal daily health systems transformation video. I view it as an informal conversation where, if needed, I'll correct what I say or clarify what I say. I appreciate your feedback. So that was question number 8. Number 9. This is the 9th question that you sent to me. Every person should be able to afford healthcare. No one should ever go broke paying medical bills. I agree. I agree with the authors of the book. We've got you covered. So these are 2 MIT, I think at least one was an MIT economist, who just made a compelling argument for a social contract that we have. We have just approached health insurance through kind of a patchwork approach over the years. We've put on different band-aids on to ensure that different populations are covered. I just think we need free, basic, universal health insurance. So I agree. Number 10, the final question: do you believe consciousness is created by the brain and that consciousness doesn't survive death? Interesting question. Thanks. I would say my medical and scientific mind would say that consciousness is created by the brain and that it doesn't survive death. But I know that there are some that disagree with me, even from a scientific perspective. I have a friend who's an anesthesiologist who's in that camp, I think. And I also, when I put on my kind of spiritual hat, I do believe that consciousness survives after death, but that's kind of on a more of a hope perspective than a scientific knowledge. So please let me know if me answering your questions like this is helpful or valuable. I'm happy to do it some more. If there are questions that you have, send them along in the comments, or you could email me at rchadswanson@gmail.com. Thank you.